Okay. Hello, everyone. I am Johanna Ralston, and I'm with the World Obesity Federation, headquartered in UK, and we are all over the world. Welcome, everybody, to this World Obesity Day and UNICEF webinar, Growing Well, Evidence and Action on Childhood Obesity. We have a fantastic lineup of speakers today and an extraordinary audience from all over the world. So we are looking forward to an informative, interactive, and we hope galvanizing and session today that can really help us to address childhood obesity. First, in terms of housekeeping, could you please introduce yourselves in the chat? Tell us who you are, where you're from, what organization you're with, and how you may be working with childhood obesity. We're really looking forward to a very interactive session. We will also be encouraging you to post questions in the Q&A box. So not in the chat, but in the Q&A box, which should be on the bottom of your screens. I got a message that the chat is disabled. So Holly, could you see about that? Apologies for that. We'll get that sorted. And in the meantime, we will, although that question came through in the chat, so I'm not sure how that worked. Okay, it's enabled now. If people could try to put their names and contact and who they are, where they're from in the chat, that would be fantastic. And then again, questions. We're going to ask you to post questions in the Q&A box. Okay, so again, we are here to discuss childhood obesity, which is rapidly becoming, or in some ways already has become, a global crisis. Since 2000, the number of school-age children and adolescents living with overweight and obesity has more than doubled, increasing from 194 million to close to 400 million. As documented in the Global Obesity Observatory, which is convening today's session, the steepest increases are occurring in low and middle income countries. According to a new report from UNICEF, which you will hear more about from our colleague Mauro Brero a little bit later in the day, for the first time in history, there are now more school-age children and adolescents globally living with obesity than with underweight, meaning that overweight and obesity have surpassed underweight in the overall malnutrition space. But recognizing as the problem grows, so does the evidence base on what works and what works in different contexts. So we'll hear some very forward-thinking and exciting developments around this. We will explore current trends in childhood obesity alongside effective policy approaches. It is my great pleasure. So we have a fantastic lineup of speakers from various parts of the world and representing, including with lived experience. And ministries of health. So it is my great pleasure to start us off with our first speaker, which is Ms. Eirini Agapidaki, who is alternate minister of health from Greece and one of the most passionate ministerial spokespeople on the topic of childhood obesity. So without any further ado, Eirini, please go ahead. Thanks.
Thank you. Thank you so much for the opportunity to join you today on behalf of Greece and to speak alongside leading experts, policymakers, and people with lived experience on the critical challenge of childhood obesity. You know, I'm sure you all know that childhood obesity is not an abstract statistic. It's a reality affecting 1 in 3 children in our country, Greece, with profound implications for health, education, and of course, the future of our society. For adults, nearly 60% are overweight and 1 in 4 lives with obesity. These numbers represent daily struggles for families, mounting pressures on our health system, and preventable risks for future generations. This is why our government, the government of Greece, under the leadership of my Prime Minister, Kyriakos Mitsotakis, has made childhood obesity a national political priority. I must say that it was my Prime Minister that had a vision to create an obesity-free, I would say, a generation in Greece. And he transplanted this vision to me since I've been working as a public health expert for years. And we have shaped this program as a national priority. This policy to tackle childhood obesity became a national political priority. So together with UNICEF, we have launched one of Europe's, I think, most comprehensive programs to reduce childhood obesity with a very ambitious goal from 37.5% in 2019 to 24.5% by 2030. Our approach is multi-level, evidence-based, and equity-focused. Primary prevention promotes healthy lifestyles through school-based initiatives such as our school program integrated in the school curriculum Food for Action and the Journey of Food, alongside community events and partnerships with nutritionists, chefs, and educators. At the secondary prevention level, we ensure the early detection through pediatric screening and referral for free nutritional telecounseling services, providing tailored support by nutritionists, psychologists, social workers to children and their families. Tertiary prevention level includes children that has already been diagnosed with comorbidities due to obesity. So we provide for free, of course, holistic pediatric care, pilot digital tools for self-management support, and mobile apps supporting healthier habits, complemented by our mobile health units, reaching remote and underserved communities. I think results speak from themselves. Sorry, more than 89,000 students engaged in educational activities so far. 57,000 children reached through sustainable nutrition workshops, and over 260 children have already receiving individualized telecounseling nutritional support. And beyond members, these initiatives empower families, transform school environments, and build healthier communities. We are also investing in sustainability and knowledge sharing through the European Centre for Combating Childhood Obesity in Greece, which serves as a hub for research, monitoring, and regional collaboration. And in February 2026, Greece will host the International Conference on Childhood Obesity, bringing together global expertise to share lessons, align strategies, and accelerate action. Colleagues, I'm sure you all know that no country can succeed in addressing childhood obesity alone. Its causes are complex and deeply rooted in our environments, diets, and daily routines. That is why Greece is taking a whole of society approach, combining health and educational policies, school and community programs, food system reform, and family empowerment. At the same time, we recognize the importance of global cooperation. By sharing evidence, lessons learned, and best practices, countries can accelerate progress and strengthen accountability. Together, we can ensure that every child grows up with knowledge, support, and opportunities to lead a healthy, active, and fulfilling life. Prevention is not an ideal. It is our responsibility, our investment, and our promise to future generations. Thank you so much.
Thank you Thank you very much, Minister. That was an excellent and inspiring introduction to our topic. Trying to start my video here. Am I here? Yes, perfect. Excellent. And again, probably one of the major takeaways with that is that you have the Prime Minister leading this effort, that it is at the highest level of government in Greece, which is critical. We cannot solve this without that level of political support, and Greece should really be an inspiration to other countries, and is certainly an inspiration to all of us at World Obesity Federation. So thank you very much for that. There may be questions in the panel later, but for now, I want to say thank you, Efaristo, and we really appreciate your setting up the stage for a really, really important discussion. So again, thank you very much, Minister.
Thank you. Thank you.
And now it's my pleasure to move over to get the lived experience perspective, and from the African continent, from Ogweno Stephen, who is a lived experience member, board of trustee member at World Obesity Federation, and he will share his journey from a child with obesity to the inspiring global advocate that he is today. Thank you, Ogweno.
All right, thank you very much. Can you hear me all right?
We can hear you. It's a little bit wavy, but
Great.
it's
All right,
fine.
I hope that you can hear.
So we can
Is
hear
this
you, and if it's a
better?
problem, we can just if you we can jump, we can support you if we need to. But
Okay,
for now, we
okay.
can hear you.
All right, great. Let me know if this is better. Otherwise, I'd assume it is, and I'll carry on from there. So my name is Ogweno, and I'm going to spend the next 3 to 4 minutes sharing a little bit about my experience with childhood obesity. So growing up with obesity in Africa is very interesting. When you're a kid or an early child, this is me at just a few months old, and we always had neighbors and guests come at the house and pinch me in the cheeks and say, "Hey, you have very chubby cheeks. You have a lot of weight. That means your parents are taking good care of you." And because my parents didn't also understand what childhood obesity was, they just picked that up and they were, yes, we need to feed him better. We need to, encourage this weight. They didn't realize that at the time I was already overweight as a kid and already beginning to develop obesity back then. And then I remember in primary school, as we entered the adolescent stage, which is around the ages of from 12, really, but 13 all the way up. This is really when I had my first wild shift. All through my early childhood, everybody was always congratulating my parents and saying how good they are taking care of me. But when I got into my teenage years or at adolescent age, I remember we met with a group of boys in the park and everybody was flexing their abdominal muscles and I had a protruding belly back then. And I was so out of the conversation. I was wondering to myself, why am I not like everyone? And this really made me self-conscious because everybody else seemed to be doing chubby. School uniform can't fit me. I developed gastrointestinal reflux disorder, which is a condition where you tend to regurgitate food after you've eaten it, because if you eat less food, you tend to be more hungry. I had dental issues as a result of this. I had a lot of stress early on, and even at my lightest, even when I was very light, I still, when I went to check my BMIs, I always had overweight and obesity as the answers to my BMI from a very early age. Okay, next slide. Yeah. So this experience was a very challenging experience for me in the sense that I wasn't like most of my peers and there was a lot of activities that I couldn't do. However, when I joined my high school, this is actually where my wellness journey started. And a teacher noticed me and noticed my condition as being someone who actually needs attention and some care. And with the knowledge that he had, his solution was to get me in the traditional move more, eat less program. And as a result, I went into extreme sports, extreme diets, and even after following a very religious physical regimen, and even after following a very strict diet program for 5 years, when I ended up going to the weighing scale and checking my weight, instead of losing weight, I had actually gained more weight. And this was this really hurt me because I'd really committed to reducing my weight and reducing my kilos and my size, but that did not happen despite the fact that I was eating way less food. I was moving way more. I played rugby, I played handball, which are very hard sports. But still I gained weight despite the conventional advice. And so what eventually ended up being the solution for me was a mix of interventions. And also a strong community, which really encouraged me to continue adopting healthy lifestyle and some clinical intervention as well. And so after another few years, and this is now me in campus, I ended up losing a lot of weight drastically. But I stopped focusing on weight as my key metrics for my health, and I started focusing more on my body composition. And so I think when I was in my second year in campus, my goal became I want to build more muscle than fat, and that's gonna be the way to get to change my body composition. So I got into resistance training, I got into active sports, and my goals shifted. I wanted to be more comfortable in my body. I wanted to have a better body composition because I had already realized that the weight metrics, I was always gonna fail in that. I'd already tried the typical advice for the previous 5 years and nothing worked. And so the funny thing was that even now, when I'm at much reduced weight from where I once was, and even now when I've been working out and doing resistance training and monitoring my diet and engaging in all these different activities, yesterday I'm still in the category of overweight and obese. Next slide. Next. All right, so the next few slides will be very short because I'm literally just going to be focusing on my advocacy journey since then. In 2015, I realized when I joined campus that this was not only my problem. I realized that this is a problem for so many other young people in campuses in Kenya and across my village, and I decided that I'll start the Sterling Foundation while in campus to specifically address the question of educating the community on these conditions, improving literacy. And over the years, we've ended up working in policy, working in research, working in innovation. And in 2023, I joined the World Obesity Board as a lived experience representative, continuing to champion the work on childhood obesity, both locally and globally. I believe this would be the last slide. Next slide. Yes. And so the mission ahead with all of this work and intervention and activities is that the goal is really to end childhood obesity. And in Kenya and even in Africa, the numbers are rising very sharply due to genetics, due to the food environment, due to the built environment, due to policies that are pro-industry and not pro-health. And on ground, we have been doing a lot of work on education, on awareness, on storytelling. And at a higher level, we've been working a lot with our local governments on research, on policy, on advocacy, influencing policies around trans fat regulation, food advertising to children, and food labeling, and with a lot of recent success with the Kenya adopting the new nutrient profiling model. So in conclusion, I'd like to say that ending childhood obesity and ending obesity in the more broader scope really requires empathy. It requires awareness of the condition, and it requires collaboration from families, from schools, from policymakers, and from the media. And it really requires the voice of lived experience. Someone who has gone through it will tell you what you probably didn't know about this condition. And I think that would be the approach to really address and end childhood obesity. And with that, thank you very much, and back to you, Johanna.
Excellent. Thank you. That was a really, really great story and so important to have that storytelling. So thanks so much. And very much, it's not we do this or that. We do this and that to address obesity. We do, it's a disease and a driver of other diseases. It's driven, and it can only be managed working across all sectors. So thank you very much. It's been great to also have you as a trustee of the World Obesity Federation and serving on key WHO committees around this as well. Thank you. And now it's my great pleasure to introduce a presentation by World Obesity Federation past president, Louise Baur, who is a pediatrician specializing in child and adolescent obesity, who is going to present on the why the urgency around child and adolescent obesity at this particular point in time. If we could, this is a
Welcome.
recorded presentation.
My name is Louise Baur. I'm the chair of Child and Adolescent Health at the University of Sydney. I'm a paediatrician, and I want to talk with you about child and adolescent obesity. Why the urgency? Now, we know that child and adolescent obesity is globally prevalent. Let's have a look at this. What's happening with the prevalence? Well, we know that it's is increasing, largely from the 1980s in many high-income countries, although in recent years in those countries, there's been a relative plateauing of prevalence, say in Europe, Japan, Australia. But it's now an issue in many Asian, Pacific and Middle Eastern countries, and preschool-aged children, not just school-aged children, are now affected in numerous countries. Let's look at some of the data from the World Obesity Federation, which published this while working with the NCD Risk Factor Collaboration. So here we can see a map. This is available on the World Obesity Federation Global Obesity Observatory, which looks at the global prevalence of overweight and obesity in boys aged 5 to 19. In general, the girls have a somewhat similar distributional pattern. And basically, the darker the colour, the higher the prevalence. And you can see here that you can see parts of Middle East, parts of Europe, South America, the US have high prevalence, but so too places such as other parts of Middle East and North Africa, China, and what you can't see here just at the moment is that there's a very high prevalence in the Pacific and indeed in the Caribbean. So you can see of the top 10 countries, you can see almost all, not quite all, are in the Pacific in terms of prevalence. Now, let's not look at prevalence, but the numbers of children and adolescents who are of school age, 5 to 19 years, with obesity. And these are the predicted numbers to 2030. And what you can see is that in 2020, 158 million children and adolescents aged 5 to 19 were affected by obesity. By 2030, estimated to be 254 million, which is an estimated 160% increase over 10 years. You will ask, well, where do they live? Well, when you look at the countries predicted to have more than 1 million school-aged children and youth living with obesity in 2030, then of these top 42 countries that you can see here, 35 are low or middle income countries, and 3 of the top 4 are in Asia: China, India, Indonesia. Now, of course, those are countries with high population levels anyway, but the numbers of affected children and young people are high. You'll need a response in those countries. Well, let's look at some other data from another study led by the NCD Risk Factor Collaboration, and this looked at changes in thinness and in obesity over more than 30 years in 5 to 19-year-olds. And this was published in The Lancet in 2024. So what you can see here are age standardized combined prevalence of thinness in the bright light blue and obesity in the crimson color. So in this, both of them used BMI to do it. So if your BMI was less than -2 standard deviations, you were denoted as thin. But if your BMI was greater than 2 standard deviations, you were denoted as having obesity. And so what you can see here, and it takes a little while to work it out. So on the left-hand side, you see the circle is in 1990, and all those different colors all around there are countries, almost 200 countries, and they're grouped by region. And on the right, you see the same countries, but you see the values for 2022. Now, if you just look at the forgetting which countries are affected in 1990, you can see quite a lot of the bright light blue. There are a lot of countries where there was a lot of children with thinness in terms of prevalence. By 2022, the numbers of light blue, the amount of light blue has decreased. Those countries, many in Africa and Asia, the prevalence, however, has decreased. But what you can see between 1990 and 2022 is an increase in the prevalence in many countries of that prevalence of obesity. And so, for example, I'm just highlighting here Polynesia, Micronesia, Melanesia. the Middle Eastern countries, the Caribbean, and other countries include other high-income countries, including and South America and high-income countries. So from 1990 to 2022, the increases in the combined prevalence of thinness and obesity, the double burden of malnutrition at a country level, were driven by increases in obesity and decreases in double burden by declining underweight or thinness. So now high BMI, which is what we've been looking at, might be prevalent, but does it actually cause any problems, particularly in children and young people? Well, the answer is yes. To some extent, that's why I'm talking to you. Here is a cartoon, schema from a review that was published 3 years ago in Lancet Diabetes and Endocrinology, showing the various body systems that can be affected by high body fat, and particularly by more severe obesity and central obesity. So, of course, not everyone with high BMI or high body fat have any health problems, but more people they are more likely to do so the higher the BMI, the higher the body fat. And you can see a range of body systems are potentially affected. We can see some of the ones that we might want to particularly focus upon here in terms of this schema. So there's poorer health in childhood, including hypertension and metabolic disorders such as dyslipidemia and insulin resistance, lower self-esteem, a higher likelihood of being bullied, poorer school attendance levels and poorer school achievements, poorer health in adulthood, including a higher risk of obesity and cardiovascular disease, and poorer employment prospects as an adult and a lower paid job. So this would suggest you'd need to take it seriously indeed. We are seeing more obesity-associated complications in not just high-income countries, but countries with high prevalence of child and adolescent obesity. So we see more children with obstructive sleep apnea, more with signs of insulin resistance or pre-diabetes. And this is, you're looking at the underarm, the axilla of an individual, and you can see that thick and darkened skin, acanthosis nigricans, which in this case is indicative of insulin resistance. And here we see an X-ray of the hips where there's been a slipped femoral epiphysis that has needed to be pinned. So these are examples of obesity-associated complications that are being seen and managed more frequently in many countries. We've seen, associated with some of this, the rise of type 2 diabetes, previously some decades ago never heard of in children and young people, and now increasingly. However, this particularly affects Indigenous young people, not just in Australia, and this is an example of this, but in countries such as Canada, the US, and other countries where there are Indigenous populations. And this is to some extent driven by high BMI, high body fat, and particularly central fat distribution. And there are a range of other medium to long-term problems. So obesity in childhood, and particularly adolescence, is associated with risk factors for later heart disease and diabetes in adulthood, poorer psychosocial functioning in early adulthood, persistence of obesity into adulthood, an increased risk of metabolic syndrome at early to mid-adulthood, an increased risk of a variety of cancers in mid-adulthood, and increased risk of death or complications for later cardiovascular or other disease. I'll just pick up on a couple of these. So in one of the famous, the Bogalusa heart study, which started some decades ago, here you can see that child BMI quartile 1, 2, 3, 4 was associated with risk variables of metabolic syndrome in adulthood. So the higher the child, the higher the quartile of the so the higher the BMI or the higher the childhood insulin quartile, the more likelihood there was to be presence of metabolic syndrome in adulthood. And a study published over 30 years ago in the New England Journal of Medicine by Viva Must and colleagues, looked at adolescent weight status and what that meant 55 years later in terms of adult heart risks. And you could see particularly for men, but women had an increased risk as well, that a higher BMI in adolescence was associated with an increased risk of coronary heart disease in men, as well as cerebrovascular disease, colorectal cancer, and in women, and potentially breast cancer. So child and adolescent obesity is globally prevalent, and it is associated with a range of immediate and longer-term health problems. It really can no longer be ignored. It's definitely time to act. I know the other speakers will address this issue. Thank you.
Thank you very much, Professor Baur. That was an excellent presentation. And now I know we're a few minutes behind schedule. We are going to Mauro Brero, who is Senior Nutrition Advisor at UNICEF, to tell us more about the new report called Feeding Profits, How Food Environments Are Failing Children. Mauro?
Thank you very much, Johanna, and warm greetings to all the participants. It is really an honor on behalf of UNICEF to co-host this important webinar and also to be part of such distinguished panelists. I see my camera is not switching on. Probably I need support with. Okay, thank you very much. I am delighted today to present some of the key findings of our Child Nutrition Report 2025 that was released in September this year, and that it is called Feeding Profit, How Food Environments Are Failing Children. The report examines the rising trends in childhood and adolescents overweight and obesity, and analyzes some of the powerful forces that are driving these trends, and also proposes some of the key actions that we need to improve child nutrition, health, and well-being. The next slide, please. So the first finding of this report is that in 2025, for the first time in our history, the prevalence of obesity among school-age children and adolescents has overtaken that of underweight. And so obesity became the most prevalent form of malnutrition in this age group. And compared to the year 2000, there are today 100 million children and adolescents more with obesity, which has tripled in the past 25 years. This is a very concerning situation. We have observed that this transition has taken place in all regions in the world except South Asia and Sub-Saharan Africa, where unfortunately the trends are also moving along the same trajectory. And also we found that obesity, as it was also extensively shown by Professor Baur, is not a problem only of high-income countries, but actually we observe the steepest rise in obesity among children and adolescents in low and middle-income countries. For example, in South Asia, obesity increased over 5-fold since 2000. The next slide. The report also analyzes what are the key drivers of childhood obesity, and unhealthy diet emerged as the major driver. Unfortunately, unhealthy and nutrient-poor foods are embedded in children's diets since the early years, and they are influencing lifelong dietary preference for highly sugary, salted, fat foods, and also artificial flours. And the consumption of unhealthy and nutrient-poor foods increases with the age. And in the adolescence, among children aged 15 to 19 years, we observe that 60% of them consume sugary food every day, and over 30% of them consume sugar-sweetened beverage daily. Today, it is also an important day because it is the day of the official launch of the Lancet series on ultra-processed food and human health, which also shows very worrying trends in the increasing consumption of ultra-processed foods, including among children. UNICEF analysis has shown that ultra-processed food are becoming staple foods in the diet of children, especially in high-income countries where they contribute often to over half of the caloric intake in children's diets. The next slide. Now, if we look at what are the key drivers of unhealthy diets, we see that it is not children or families who are failing to adopt healthy diets or healthy lifestyles, but it is systems who are failing children. What children consume and what it is available, what it is affordable, what it is convenient, and even what it is desirable for children, it is shaped by market forces that are driven by profit and not by public health or human rights. Unfortunately, food environments are increasingly being inundated by unhealthy and nutrient-poor foods, by ultra-processed foods. And marketing is one of the main forces that also encourages the consumption of these products among children, often also using the insufficient capacities in children as they're still in the middle of their cognitive development to understand if a message has a persuasive intent. The next slide. The report is also analyzing food environments in terms of the availability of policies to protect children from unhealthy foods and unhealthy diets. And it found that unfortunately today, no country globally has a comprehensive set of policies and legal measures that can protect children from unhealthy food environments. So we analyzed 10 proven policies with effects to limit the consumption of unhealthy foods, and unfortunately no country has this comprehensive set. One of the main barriers for the adoption, according to some research that we conducted in these countries, is the interference of the ultra-processed food industry, which systematically delay, weakens, or blocks government policies. And so this is one of the main barriers that the governments have to address. Fortunately, we also have good examples. We have countries, especially in Latin America, like Mexico, Brazil, Argentina, Colombia, Chile, that are implementing a comprehensive set of policies. And also we have heard earlier from the Minister of Health in Greece, we have also countries that are making important progress in other regions. The next slide, please. And to conclude, what are the key recommendations now to transform and to improve children's food environment? The first two recommendations is about having a comprehensive set of policies that on one side limit the unhealthy foods, and on the other side, they improve the availability and affordability of locally produced nutritious foods. The third key recommendation is to establish robust safeguards to protect public policy from industry interference. And one important recommendation is also to engage young people in public policy making to claim and advocate for these policies. And later in the webinar, we will hear excellent example from youth advocates. I stop here and I thank you very much for your attention.
Thank you so much. It's Mauro, that was excellent, and Mauro will be available. Now it is my great pleasure to introduce Professor Pekka Puska, who is chairman of Terve Painoi. I do not speak Finnish very well, the Healthy Weight Association in Finland. He is former member of parliament in Finland, an expert in public health policy, a WHO leader, and if you're familiar with studies like the Karelia study, Pekka has done extraordinary formative research and leadership around these issues, and it's our great pleasure to hear him speak about the journey from evidence to action and how to implement public health policies to address childhood obesity. Thank you.
Thank you, Johanna, very much. Good afternoon from Helsinki, and I'm happy to contribute to this good webinar on a very important topic. I have been asked to talk about from evidence to action, and you can see some of my background features on the slide, but I understand Johanna already told about that. Next slide. The background of this seminar and my talk is obvious to you. One, the serious global epidemic of childhood obesity, and two, we have good evidence on its causes and what should be done. So my question is, how can we do it? Next slide, please. When it is question of nutrition, the often asked question is, whose responsibility? Is it individual responsibility or societal responsibility? Of course, it is both, but we know that the individual weight reduction plans, although they can help the individuals, they contribute relatively little to population obesity. The question is the environment, as has been said, to make the slope lower for people to maintain healthier weight. And certainly for children, it's not their responsibility. It's the responsibility of their environment, home, school, society. Next slide, please. So there is a public responsibility which needs and leads to policy interventions, because information and health education alone has little impact. We need priority effective policy actions. And the next, please. As I already said, research has shown very clearly some of very important factors that we should do to reduce childhood obesity. And also we have now a big number of very good strategies, global, national, professional, NGO strategies, pointing out some of the aspects that were already mentioned: taxation, marketing, school environment, and so on. Next slide reviews some of the historical development. Already decades ago, we have had very good evidence on some of the main risk factors of non-communicable diseases, including, of course, obesity. Extremely strong evidence of the numerous health harms caused by obesity. And also for quite a number of years, let me say decades, we have very good evidence on individual prevention measures, what should be done to reduce obesity. And as I mentioned, during this century, we have developed very big number of extremely good evidence-based strategies, policy strategies. But where is the problem? It is action. Even if part of our good strategies could be implemented, our public health situation would be much better. So the question is action, politics, leadership. And the next slide, please. So the problem really is how to move from strategies to effective actions, how to overcome the implementation gap. And there are many issues. One, of course, is that although we need comprehensive approach, politics usually move with relatively narrow decisions. And there's a phrase, less is more. If we want to achieve something, we must specify some priority actions. And for the implementation, policy support is important. I come back to that. We need institutional base for expertise, monitoring, media support, resources, monitoring, and leadership. Next, please. When it is question of diet, the question is, should people change their eating habits, or should we change the food products, reformulation? Of course, there is interaction between these two. When people are interested in healthier diet, the industry follows, and vice versa. So there is an interaction, but there is no question that sustainable approach, effective, sustainable, cost-effective approach is food reformulation that already has been mentioned here. Next slide, please. So for nutrition changes, we need changes in policies and changes by political decision makers and by the private sector. Of course, it is important to directly approach them with rational, good arguments, and that is very much being done for evidence-based changes, and very much identifying win-win situations. But in the long run, it is really the population that is important, because opinions, intentions, and behavior changes of the population ultimately have a strong influence on politicians. There is a saying that voters decide, and for private sector says consumer it is the king. So in the Western democracy, popular pressure is extremely important. This should, of course, be supported by monitoring, feedback, and use of media to support this kind of policy change. Some people speak of behavioral journalism. Next slide, please. Johanna referred to our work in North Carolina, Finland, when we had this terribly big cardiovascular problem, very much related to unhealthy eating. We tried to first convince people to change their diet, lifestyles, with modest success. Then we realized how important political decision making and private sector is, and we contacted them. They listened to us politely, and of course some changes were made. But the big change was only when people started to change their lifestyles. So it was easier to pass new laws, and the industry complied much more. So next slide, please. Next, please. So in my long experience, in the end of the day, it is really mobilization of people that is the most powerful thing. And really in the Western democracies, it is public pressures that ultimately move political decisions, and also industry decisions. The second thing is that success is not only caused by one policy action, even how important it would be. Success is an incremental process of changes and monitoring and support. So what we are talking about is a social change process, because when we speak of lifestyles in the community, it is social change process that is needed. And this kind of incremental process of decisions should be supported by monitoring and other means. Next, please. This picture just shows that I think success is a long-term road of social change, like this picture that I once took from Mongolia. And if I still have 1 minute time, and I will go to my last slide, which is the one that I often use in my presentations. That is conclusions. Next slide, please. Conclusions for successful public health program, like what we are talking about, ending childhood obesity. Number one, we need to combine correct theory with hard practical work. There's a saying that nothing is so effective as good theory. But theory alone, papers alone do not do the work. We need to do a lot of hard work among the people. And number two, we need to combine strong, dedicated leadership with broad collaboration. We need broad collaboration that had been mentioned, health in all policies, intersectoral work. But committees alone do not do the work. We need strong, dedicated leadership and focal points. My last slide, I think, is thank you. It's been a pleasure to contribute.
Thank you, Kitos, and tack så mycket. There was an excellent presentation, and we will come back to you with a couple of questions. We do need to move on, but again, I think the key messages around political leadership is important, as the minister from Greece, Minister Agapidaki, also noted in the very beginning, as is sort of building a social movement and demand. One of the strange benefits of having so many people affected by obesity is it's quite a political force if we can organize ourselves, and I think we can. So now it is my great pleasure to introduce Santi Gómez, who is Director of Programs and Research for Gasol Foundation in Spain, as founded by the champion basketball player Pau Gasol, will tell us more about successful strategies to address childhood obesity in Spain. Thank you.
Thank you, Johanna, for the presentation, and thank you to World Obesity Federation for offering us this opportunity of presenting today. I am going to introduce the National Strategic Plan for the Reduction of Childhood Obesity in Spain, that we had the pleasure to contribute as a strategic partner of the Spanish government. The main goal of this wide public policy is to reduce childhood and adolescent overweight and obesity in Spain by 25% during the next decade until 2030. I would like to highlight two key principles of this wide strategic plan. One is promote healthier, safer, and friendlier environment where children live and grow up, and reduce the social and gender gap in access to healthy lifestyles. It's a plan that during the development and the implementation currently are involving a total of 18 Spanish ministries, depending on their competencies for public administration. Also, during the development stage, and the government created 4 negotiation table, a part of the one formed by the Spanish ministry. Was created the scientific table, the social entities table, and also the economic table, where were represented federations and associations of enterprises. This is the logical model of the plan. Very briefly, it contemplates 7 different environments where children grow, and also consider an holistic approach, not only including healthy eating or physical activity, also including the importance of sleep and taking care of psychological well-being of children, and is a plan mainly addressed to change structurally the environments where children grow in Spain. It contains 200 measures in total, and also since its approval, it has a budget allocation and a priority inside the general state budget, and also has been created the governance mechanisms by royal decree. This means that was created an interministerial plan committee, also advisory council, and also is in coordination with sectoral conferences with the autonomous communities and also the municipalities in Spain. To date, under the national plan, a total of 11 strategies or plans were approved, and also important royal decrees, such as the one that regulate the school canteens in Spain, and that will be a reality from next spring in Spain. Also, I would like to highlight that through this national strategic plan, we were able also to activate the collaboration of the government of Spain with the WHO to join Spain inside the acceleration plan to stop obesity, where also count with the collaboration of World Obesity and UNICEF. Also, at the same time, this national plan are giving us more force to activate advocacy lines within the regional governments in Spain that have delegated the competencies regarding health and education, and are important parts of the public administration in Spain to have effective measures approved in our environment. Once I have presented the National Strategic Plan, also I would like to present the program's strategy of the Gasol Foundation. In Gasol Foundation, we are creating preventative programs and also evaluating them through cluster randomized community-controlled trials. The first one that we started to study was one family-based intervention implemented through social entities. The study protocol is already published and obviously also registered. And also the great results of this preventative program is making feasible the scalability nationally through the national strategic plan and through the funds that the government has received from the European Union, specifically from the European Social Fund, that this will make feasible to reach more than 200,000 children and adolescents in Spain with an investment of more than 100 million euros to reach the private communities in Spain with this intervention that has demonstrated positive results. And also we are starting a validation study of this strategy in the city of Los Angeles in the US. Also, we are studying other preventative models, one implemented in schools, other addressed to early childhood, and another one addressed to sports and leisure time entities. All of our strategy lands on municipalities. We give a lot of importance to the local level to be able to produce a systemic change. We are piloting a pioneer intervention implemented at local level, a whole of system approach that receive the knowledge that we are generating and we are implementing through these 4 different preventative programs. Also, inside this pilot, we are taking advantage of this European project to coordinate from prevention to treatment, including also the coordination with primary care centers here in Sant Boi de Llobregat, where we have our headquarters in Spain, and also including the hospital, and also adding to more additional levels, generating awareness at local level, and also influencing directly in the local public policies that the Sant Boi de Llobregat government are implementing. Also, to make this feasible, you know that we are influencing at national and regional level, and also we are coordinating all of our strategy with international organizations such as the World Obesity Federation, UNICEF, or the World Health Organization. Thank you so much for your attention, and I hope you are enjoying the webinar.
Thank you so much, Santi. That was excellent. I'm so sorry because we are really pressed for time here. We're going to need to go to the final speaker to make a few remarks. I'm going to ask speakers who, if you can answer questions live in the Q&A box. There are some, I think many are relevant, and just then we'll sort of have a quick summary. We will instead share written responses. It is my great pleasure now to introduce Dlamini, who is with UNICEF South Africa's Fix My Food program, and he's an advocate who will share his closing remarks and calls to action. And then I'll just come back with a couple of final housekeeping and next step remarks. Thank you. Senzo.
Okay. Good afternoon, everyone. My name is Dlamini, and I'm a physiotherapy student at the University of the Western Cape and a proud Fix My Food youth advocate. And it's truly an honor to close off today's discussion and reflect on what Fix My Food movement means for us, but most importantly, what it means for the future of our children. Next slide, please. Now, Fix My Food South Africa is a youth-led movement which is supported by UNICEF that aims to transform the food system to ensure that every child and young person has access to healthy, affordable, and sustainable food. Now, we've been working on social media campaigns, on university activations, as well as student conversations, all with one goal: to create a world where healthy food isn't just a privilege, but is a right. Next slide, please. Now, listening to the powerful insights that have been shared throughout the day, I was reminded that childhood obesity isn't about individual choices. It's about the system that shaped those choices. Now, the food environment around us is flooded with ultra-processed products that are cheap, aggressively marketed, and accessible at every corner, while healthier options remain expensive or out of reach. Now, as a physiotherapy student, I have firsthand seen how these habits we form as children get carried into our adulthood, affecting not just our bodies, but our confidence, our productivity, as well as our potential. It's not easy to tell a young person to make better choices when the system itself keeps feeding us unhealthy options. And honestly, as you can look at the pictures on the slides, I have experienced these challenges myself. There are days where I wake up late after long study nights or back-to-back clinical hours, and the only accessible or available food on campus is processed snacks or fast food. Now, this is a daily reminder that even when we want to make healthier choices, our environment doesn't always make it easy. And also, this is why Fix My Food or initiatives like Fix My Food matter, because they shift responsibility from the individual to the environment, and also from awareness into action. Next slide, please. Now, then, the recent UNICEF report titled Feeding Profit highlighted how we can take these actions to protect the children and transform food systems. So it outlined the 8 key steps, from regulating food marketing and promoting breastfeeding to supporting local food production, empowering families, as well as including youth voices in policy changing. So those steps remind us that the real progress happens when we align evidence with advocacy and when we hold the government and private sectors accountable. Now, my reflection for today is that the changes won't happen in conference rooms alone. It happens when each one of us, students, health professionals, parents, or policymakers, decide to do something within our reach. Whether it's questioning what's on our plate, or calling out misleading marketing, or supporting youth-led advocacy, every small action matters. Next slide, please. So my call to action today is simple. Let's fix our food system, not tomorrow, but today. Let's make sure that every child, no matter where they live, can grow up healthy, strong, and they can reach their full potential. Because a healthier generation doesn't start in the clinic, starts where the environment supports each one of us and enable us to make the good choices in the kitchen, in the classrooms, and in our communities. Thank you.
Thank you so very much. That was excellent and inspiring. Yes, and you have a very big popular note in the chat with lots of fire. That's fantastic. We want to thank everybody, and I'm sorry, but we really don't. And we want to respect. We've already gone a bit over time. We will respond to questions in the separately when we will follow up with you, but there are a couple of questions that have been responded to already in the chat. And just to summarize, again, I think what we heard was sort of the political will is incredibly important. Political leadership is, but so is that grassroots energy, advocacy, and passion to take things forward. So thank you everyone for a fantastic series of presentations and a very diverse. And I think we maybe just a few quick takeaways again. High-level political leadership, but also sustained commitment and taking our own power as a community We have strength in numbers. Let's use that. We have global agendas and partnerships, things like the WHO Acceleration Plan, which is very much orientated towards around this. Let's encourage the further countries to take on board leadership with that. We have data. I think it was the UNICEF report was incredibly important because it was also co-authored with or co-published with WHO and the World Bank. It really opened people's eyes that, in fact, childhood obesity has become the main malnutrition issue worldwide in almost every country. So, again, the examples that we see from Spain, and using a celebrity, the way, the passion of Pau Gasol for this topic has been really fantastic. I think you'll be seeing more about this as we lead up to World Obesity Day on March 4th. The topic of our atlas this year is childhood obesity. We continue to be amazed that we're so shocked by data, but the data continues to be shocking around childhood obesity and its impact. And therefore, let's use that shock to galvanize further action. Again, we'll follow up with you. Thank you for this. What we hope is more action, more information, more convening around this critical topic so that we can sustain it and really make some change. Thank you to each of our speakers. You were fantastic. You were leaders. You were inspiring and galvanizing. Thanks to all the fantastic participants from all over the world today. And that's all. Thank you.